Welcome to the Polishore Seri Fox Foundation. I'm Professor Michio Kaku. Over the next few minutes, you'll be hearing from the founders, Dr. Ronald Shore and Dr. Joseph Fox, along with the Foundation's principal advisor, Dr. Esther Chang, who will share with you the revolutionary cancer treatment that many believe could one day lead to a possible cure. Using nanotechnology, Dr. Chang has developed a tumor-targeted delivery system that acts like a smart bomb that takes aim solely at the cancer cells, leaving normal, healthy cells unaffected, thereby eliminating the harmful side effects associated with traditional chemotherapy. This is the holy grail of cancer research, being able to target individual cancer cells one by one at the genetic, molecular, and cellular level. Having had the pleasure of meeting Dr. Chang and discussing this research with her, I can personally say that her research is cutting edge, authentic, and shows great promise in one day, perhaps changing the entire medical landscape. Dr. Chang's research is currently in phase 2 FDA studies, and it's producing unparalleled results. The mission of the Polishore Seri Fox Foundation is to accelerate the availability of this treatment to the public, and for that, the foundation needs your help.
We are into a new form of treatment through nanomedicine.
And a new way of approaching cancer, treating cancer outside of the current thinking.
To us, the biggest challenge is to simultaneously increase therapeutic effectiveness while decreasing the side effect.
Most forms of chemotherapy has significant toxicity, and so that's why you hear about some of the terrible side effects patients undergo. And if something can cure them, they'll put up with almost anything.
Do you say it's enough? A lot of people choose not to continue treatment, or do you continue because you feel there's always hope?
Most cancer patients try, but often cannot endure the very severe side effects they encountered. Thus, the treatment has to be stopped.
Most of the chemotherapy agents, after a certain amount of weeks or months, become toxic to the body. So you have to either cut the dosage down and thereby decreasing its effectiveness, or you end up giving less of it or not at all. So you've lost the ability for that chemotherapy agent to do what it should be doing because it's now caused so many other side effects.
As we know, people on cancer therapy may lose their hair, and it may knock out their white blood cells, and they may have heart problems.
Designing a drug to cure cancer is a very tall order.
Traditional therapies, including chemo, a drug is introduced into the body and goes everywhere. Dr. Chang's therapy targets cancer cells.
Now, understanding much more about nanomedicine and the development of the particular methodology that Esther uses, I really believe it's a cure.
Have we arrived at a cure? I think we have.
With results already being published and documented.
We have done it in the lab. We've demonstrated that we were able to encapsulate a very, very toxic chemotherapeutic agent and make them less toxic and make them more effective.
It is a smart bomb.
This is not specifically for ovarian or lung cancer or breast cancer. It's any cancer.
Here's a therapy that up to this point has demonstrated unequaled efficacy, essentially no side effects, and costs less. What miracle is this?
We believe that the proper delivery, tumor-targeted delivery of a cancer drug will make a drug a lot more effective, less toxic. And think about it, when you don't need to deliver so much of a drug, it's cost effective.
And I think that the quality of life, which I think we're all interested in when it comes to treating patients with cancer, will improve dramatically.
We also hope that the therapy will significantly impact the overall survival and improve the quality of life for the cancer patients.
My goal in seeing the foundation promote this is to make it much more readily available to the public and to promote this particular type of treatment as, in my opinion, the new way of approaching cancer.
This is such a terrible disease, not just lung cancer, but all these systemic cancers, that I think we need to do more. There's no need to wait 50 years for something when we have something so promising right now.
It takes great resources to develop each stage of the process, turning a strategy into a real cancer therapy.
People who are watching this video, hopefully other organizations that share with us this real need to cure this disease. We think we can make a real difference, and I'm not talking 20 years from now, I'm talking in the very near future.
For more information, please visit deliveringcuresforcancer.org.